Lung cancer is the most deadly of all cancers and second only to skin cancer as the most common type of cancer. More people die of lung cancer than breast, prostate, and colorectal cancer combined. The main reason is that only 15% are found with localized cancerous cells. 85% of lung cancers are found as late-stage cancers, often after metastasis. Repeated exposure to toxins we inhale can cause chronic tissue irritation, setting up the framework for the development of abnormal cell division. It is said that 85% of all cancer deaths are due to cigarette smoking. However, there are a lot of other toxins that we come into contact with. For example, hydrocarbons are those fumes that we inhale while pumping gas. Cancer is divided up into small cell cancer and non-small cell cancer, which can also be called large cell cancer or carcinoma. The small cell cancer is about 100% deadly and basically comprises only those who smoke. Smokers can, however, get any of the other types of cancer, but they all have a better prognosis than the small cell carcinoma, especially if caught early. Within the small cell lung cancer group, there is an oddity that may occur, and that is that the cancerous tumors in the lung begins to secrete a hormone. It might secrete insulin, causing signs and symptoms of hypoglycemia, or antidiuretic hormone, resulting in SIADH, which is syndrome of inappropriate secretion of antidiuretic hormone, or any of these other listed hormones. These tumors secreting small cell cancers are also called oat cell carcinomas. It affects a smaller group of patients, but it is a very aggressive and deadly type of cancer and type of the small cell lung cancer. Solid cancers are staged from 1 to 4, and stage 1 and 2, which would have the very best prognosis, only results in vague symptoms like an expected smoker's cough or something like that. Stage 3 and 4 have poor prognosis, and that is when symptoms really appear and will send the patient to the doctor. Things like hoarseness, hemoptysis, painful breathing, etc. Therefore, we need to teach smokers about primary prevention, which is smoking cessation, or secondary prevention, which would be some type of screening to hopefully detect the cancer early enough. The patient first comes in with symptoms. They may do a chest x-ray or CT, then be referred to a pulmonologist who can do a bronchoscopy looking into the bronchi and bronchioles for anything abnormal, or they may be referred to a surgeon to look into the thoracic cavity. When they see anything that is abnormal, they can take a biopsy for cystology testing to see what types of cells they are and how abnormal the cells might be. Because lung cancer affects our breathing and comfort, there are often a lot of palliative measures that need to be taken. Case scenario with lung cancer is to have a non-small cell lung cancer found at stage 1 or 2 and to be able to remove all of the cancerous cells surgically. That may mean removing either a segment or a wedge of the lung with an early staging, or it could mean removing one of the 5 lobes of the lung with a more advanced staging. When they do a pneumonectomy, they cut and suture close the large bronchus on the operative side. Positioning post-op is whatever the surgeon orders. Remember that any time we allow air between the parietal pleural and the visceral pleural, which is done with any lung surgery, that a chest tube is needed to reinstate that negative pressure. However, if we remove one entire lung, well, then we don't need the chest tube for that lung because it's gone, and we don't need it for the non-operative lung either. So what are the priority care issues post-op lung surgery? And they are frequent respiratory assessments to make sure that you're going forward and not backward. Also, early ambulation using the incentive spirometer, making sure your patient doesn't get any infections, nutrition, pain control, etc. This last slide shows you some very negative assessment findings concerning the respiratory system that could indicate some kind of cancer of the lung. Hoarseness, dyspnea, wheezing, tachypnea, persistent cough, rust-colored or purulent sputum, blood-streaked or hemoptysis, shoulder pain or arm pain with respirations, recurring episodes of a pleural effusion, pneumonia or bronchitis, weight loss, and unexplained fever. All of these are possible indications of an underlying cancer.